All right, you can face the front again. I think my camera stopped again, so I'm not sure how much that it missed. But I was auscultating the lung fields on the back. I asked her to turn to the front. I'm going to inspect before I do anything. I'm looking for any thrills or lifts, heaves or lifts. And now I'm going to listen on the front. You breathe in and out for me. Thank you. And then I would go down farther. I don't want you to hyperventilate. Sorry, I was just thinking how much of that we've missed. But I'm going to go onto the heart. We're going to listen in 5 different spots with the diaphragm and then 5 different spots with the bell. You can just breathe normally. Listening for any extra sounds, listening for S1 and S2. Paying attention to the rate and the rhythm. And then, sorry, I don't mean to get too personal there. And then again with the bell. Doesn't want to turn. There we go. This here's deeper sounds. Now to listen for a murmur, I would ask you to lean forward. Can you go ahead and do that and take an inhale? And then that's a better way to hear the murmurs at the base. Okay, base of your heart. Thank you. Mm-hmm. Or you can have the patient lay on their left side and kind of listen that way. I won't make you do that. So on the next part is the abdomen. The camera can't see me, but I'm not going to do this for your privacy. But I would inspect first. I would visualize, look at the umbilicus. Look for any obvious hernias, any movement of like blood vessels, like pulses. And then I would, so the order is inspect, auscultate this time. So I'd listen to the 4 quads, and I could listen over your aortic artery and your renal arteries. And you want to do that before you palpate, because palpating and percussing can alter the vowel sounds. And then I would percuss like I did on your back. This time locating your liver and your spleen. And then palpate. So I would rub to feel any hardness of your liver, your organs, and any ascites. Your stomach would be really tight and full. Last but not least, I could feel your pulses, your femoral pulses. I won't do that because that's right in your groin area. And again, I would wear gloves doing that. So when we move on to our upper extremities, I would look at your arms, note the skin, the color, the temperature, which it's hot in here. I would take your pulses, your radial and your brachial. I would note your nails, see if there's any clubbing, any discoloration. I would check the capillary refill, which is good. Also, I would sensation like I did with your face to see if you could feel both sides. And I would move on to your lower extremity. We would inspect your feet, and I'm not going to make you take your socks off, but we could do your capillary refill, your pulses, your femoral, your tibial, and your radial. Tibial is behind your ankle, can't see, and radial is the top of your foot. Cap refill in your toes. Again, the sensation on both sides. Also, I'd have you close your eyes and move your toe up or down, your big toe, and you would tell me which direction I'm moving it. Okay, and then, the neuro assessment we did before and you didn't do too well, where I had you stand up, close your eyes for 20 seconds and see if you